Olá pessoal, mais um episódio do SBU em situ aqui em Chicago, AUA 2023. Eu vou falar um pouco do que tem de novo da cirurgia reconstrutiva. A cirurgia reconstrutiva ganhando um papel muito importante aqui na sociedade americana. E como novidades, eu vou trazer um trabalho do brasileiro André Cavalcante, que apresentou sobre ressonância nuclear magnética, uma imagem, um novo approach, um novo exame para os pacientes com estenose de uretra, com uma imagem muito boa. E também vou falar de Dr. Dmitriy Nicolavski, da Universidade Upstate, em Nova York, falar sobre o implante de esfíncter artificial em pacientes pós-uretoplastia, fazendo a comparação em pacientes que fazem a uretoplastia anastomótica comparado aos pacientes que fazem não transect uretoplastia.
Obrigado. The rest of the presentation will be in English, I'm sorry. So this was an interesting question and a hypothesis that we had a couple of years ago with our friends to see if the non-transecting, non-excisional techniques are protective in the patients who in the future they have artificial urinary sphincter. So imagine a population of patients that at first had a urethroplasty of some sort, and then they recovered from urethroplasty, then they have artificial urinary sphincter. We had a suspicion that if you preserve the urethra as much as possible, preserve the vascularity of the urethra, and do urethroplasty that is non-transecting, we think that there will be less trouble in the future with artificial urinary sphincter. So for that, we reached out to many of our friends around the world, and I think almost every continent was represented, several sites in Brazil, Europe, South and North America, and asked them to present their results, many questions in the database. At first we received 106 patients. By now we added more. We have now 178 patients, analyzed it in every way possible. Roughly there is half of the patients were transecting techniques, and half of the patients roughly were all kind of non-transecting techniques. And guess what? The duration, the longevity of artificial urinary sphincter in the non-transecting techniques were better. They lasted longer, less erosions, less atrophy, and less mechanical failures and infection combined all together or separately in our favorite non-transecting techniques. Now this study is undergoing further analysis, statistical analysis, to see if there are any kind of confounding factors. Is it radiation maybe, or size of the cuff that influence the outcomes in addition to urethroplasty technique? But it's very promising, and our suspicions, I think our suspicions were correct. Try to preserve the urethra, try to preserve vascularity, like you would do for nephrectomy. People are trying to preserve every nephron if possible, but it was an uphill fight a long time ago. Now I think we're settled with that, and we're trying to answer this different question. Preserve the vascularity to the urethra.
Thank you, Dr. Dmitry. Então, sintetizando o que o Dmitry falou, comparando com os pacientes que a gente faz um nefron spare numa nefrectomia, a gente também tem que pensar em poupar a vascularização uretral, e a nova tendência que foi bem clara aqui no Congresso americano é preservar a vascularização uretral, fazendo técnicas não transectantes, é a direção da cirurgia reconstrutiva.
And I would like to thank all our friends around the world who contributed. I know it was a lot of work, but I think together we could prove anything. We could go to Mars if necessary. We can even go to Brazil together if necessary. Okay, thank you.
Thank you, Dr. Dmitry.